My name is Ricardo, and I'm the business operation director for the region of Miami. I'm a little bit different than all the business director because I actually am a nurse. So I've been working as a nurse for 8 years, and I also have a background in home health. We are partnering with the hospitals. Those kids, they need our services at home, so we're trying to part them out to make sure the transition is smooth. They get everything that they need, and they understand what is required to provide services. One of my main roles is to extend our help to make sure the families understand what home health is and how we can help them out. For those kids might be under the challenge than others, and then how we can help as a one-to-one, to understand that we can provide those services or that help to those families, not only for a little bit of time, but also 24/7 to create a better environment for them and in the room, to one-to-one. When we want to hire nurses, we want someone who's caring, and not only for pediatric, but actually have the heart for caring, to advocate for patients. Someone who wants to be involved and wants to be a part of a family to make a difference. So even though that you might not have the pediatric experience, we can actually train you. The only thing that we require is someone who can make a difference, or someone who can connect and is willing to work with these children that need the most help. It's just kind of different when you work at the hospital, and I know I have that experience as working at the hospital. You never get to connect to patients. Your job is to make them stable, and then they go out the door, and then you have a new patient come in. When you go to school, and those are the new nurses, like myself, when we go to school, we have a different mindset. We have the mindset that we can make a difference, that we can connect, we can help this fellow patient in a different way, not just physically, but spiritually. What it takes to be this nurse is you actually can do what you thought or you wanted to do from the beginning. So you actually connect not only with the patient in a different way and in different levels, not just physically, but also emotionally, but you also connect with the family. So you actually make a difference. So you impact a patient and you impact the family in a positive way. So that's what it takes. If you have that kind of heart, if you have that kind of drive, this is the place to be. This is where you want to be working at. You're not just a number, you're not just an employee, you're part of a team. So it's not just providing services, for a patient. We are providing services for a family.